Good evening. My name is Russell Ackaway, and you're watching the Respect Show. We will take a departure from the normal Respect Show this evening to talk about psychotherapy. This presentation is going to be in two parts. Tonight is part one, and part two will be in January of next year. I have with me Lana Ackaway, my wife, who is a certified lay psychoanalyst, licensed clinical social worker, and a certified New York State alcoholism counselor. And I'm glad to have her on board because we're a dynamic duo, except at times we're like oil and water, but most of the time we're very loving. So the departure is that we don't have a panel of youth here voicing their feelings and thoughts about a particular topic. This time I'm the individual who's voicing my thoughts and feelings about a particular topic, and that is psychotherapy. Basically, psychotherapy covers every kind of therapy imaginable. It's a broad umbrella for behavior therapy, primal therapy, psychoanalytic psychotherapy, dialectic therapy, cognitive behavioral therapy, to name a few. Why are we having this show? Why am I talking about this? Because there really is, as far as I know, very little consumer information on psychotherapy, namely what it is, how do you know you need it, how do you know you don't need it, what it should cost, who's qualified, how do you evaluate therapy while you're in it? Many of these questions will be answered in the second part of this presentation. For now, we're going to talk about therapy. Why not? From a psychodynamic perspective, and I'm going to turn to Lana to describe what the psychodynamic perspective is versus a cognitive behavioral perspective. But
Okay, thank you for inviting me, and you're right, many times it is oil and water, but mostly it's not, and I hope we can keep it to the non-oil and water on this show. And if I get a little lost, I'll turn to you for clarification, which I often do get lost because I'm a very feeling person. Anyway, a psychodynamic perspective takes into consideration instincts and impulses that really turn into psychic energy in the mind. This is all unconscious. I like to describe it as a process, and the process is the child originally drinks in a family, and the child is selfless in the beginning. So he or she drinks in a parent and a sibling, and in later life performs a very significant off-Broadway show and turns the feelings and ideas and thoughts unconsciously into a behavior pattern. Psychodynamic therapy differs with a lot of other therapies to the extent that 93% of the mind, at least in my belief system, and in my husband's belief system, is underground. Cognitive behavioral therapy believes that you can take your feelings and push them aside and talk about positive thoughts. Would you like to add anything on CBT or cognitive behavioral?
No, that pretty much covers it. It's a cognitive behavioral therapy. relies on a mental thought approach. The person's not thinking right. And if you can change someone's thinking, you can change that person's behavior. Okay, Lana and I have cumulatively a half a century of education and training in psychotherapy and psychoanalysis and clinical experience. What we're going to say tonight comes from our informed knowledge and experience, very informed knowledge and experience. Okay, we have a call. Hello? I can't hear the caller.
Hello?
Hello?
Hello, I'm sorry. How you doing tonight?
Okay.
Hey, well, this is a good topic here. I was actually a former patient of psychotherapy, actually, and we've learned, obviously, I'm sure you know about free association and fantasies and repressed memories, and I was having some family issues. And when I was speaking with my psychotherapist, I actually had one of those repressed memories pop up. It happened when I was 10 years old. I remember I went to my mother and I said, "Mother, how old are you?" And she said, "It's not polite to ask a woman her age." And next day I went to her and I said, "Mother, how much do you weigh?" And she said, "It's not polite to ask a woman her age or weight either." So next day when I said, "Mother, how come you're divorced?" And she said, "Well, you're too young and you're older, we'll discuss it." Well, I was able to find out this information. I went to her driver's license. It said she weighed 130 pounds. She was 35 years old, and in sex, she got an F. And I kind of blocked that out because I hate not having a father growing up. Not somebody to play baseball with. Nobody to tell me about the birds and the bees.
Did you have a question?
Memory.
Did you have a question or issue you wanted to ask?
A question? Yes. I'm sorry, this is a little difficult, but Russell, I know this show's called Respect. Do you respect Howard Stern's penis?
Say that. It's hard for me to understand. Say that again.
It's cut.
It's cut. Okay. All right. One of the first things we will cover is the myths and realities of psychotherapy, all psychotherapies. And there are close to 600 plus therapies. So I'll start with a few of the misconceptions. One of them is people come to therapy thinking that it's a cure. It's not a cure. People retain their character. No one really loses character. For example, if you're outspoken, you're going to be outspoken. If you're quiet and shy, that's not going to change that much. If you can't commit yourself to a project or another person, that issue will be there. Nothing really changes. What changes is your ability to control the self-defeating parts of yourself. And what you learn is you learn how this comes up, how the self-defeating part comes up, and how to deal with it and how to control it so it doesn't interfere in your work and personal relationships. You want to take a shot?
Yeah, it's a good, broad, overall definition. I must say so. In terms of an example of this definition, is that I once had a patient that was from Ireland, and she came to me because she was severely abused by a parent figure. And she thought that it had to do about restructuring an entire personality. She really didn't get it. And after a lot of time that went by, and she finally understood, she was raging at me for a lot of issues in her past. She was basically a disconnected lady. But to make a long story shorter, she finally opened up and sent me a little Christmas card. And at the bottom of it, it said, therapy is not about seeking greater landscapes. It's about having new eyes. And Lori finally got the premise. And over time, she became closer to me, and we were able to discuss the anger that she had based upon the present and related it to the past.
Good example. I just want to take one step back. I don't think I answered the question of why are we doing this. There isn't a consumer directory for psychotherapy. There are many doctors, medical doctors, who specialize in certain aspects of medicine. Others are internists. You can find the names, what schools they graduated from, what their specialty is. Hello?
Hi, I have a therapy question. I was curious about things like Scientologists and how they're against therapy. Why would they not want people to get therapy?
Give me the question again.
Like some religions, like Scientology, don't want people to get therapy. They're against therapy. So why would that be?
As far as I can say, is that Scientology is, in my belief system, more of a cult.
Oh, hey.
And they really want to keep people within the cult believing what the cult is prescribing, and without any outside influences or changes.
Really?
It's, people, there's a lot of celebrities in that type of approach. But it's a very rigid, dogmatic approach, and there's very little freedom.
Okay, so does therapy bring freedom? What do you think?
Yes.
And self-awareness. And the cult philosophy is everybody should be the same. There's no basic individuality, that an individual can evolve based upon his or her potential. And one of the actors, just in the initials, TC, is very much against psychotherapy.
All right, thank you very much for answering my question.
And JT, too. Okay, so there is no, you as a consumer, how do you know, who to go to if you're having emotional problems? Most of the difficulties that people have are either depression or anxiety, or some combination of both. We're not talking here about serious psychiatric disorders like schizophrenia or bipolar disorders. We're talking about regular run-of-the-mill personality disorders, depression, anxiety.
You're also
That's
talking
another
about
topic.
trauma and post-traumatic stress disorders. We're talking about people that have never bonded or attached in their formative years. So there are three classifications. There are attachment issues and trauma, as well as depression and anxiety.
Okay. And
We're leaving out the psychotic issues.
okay. So therapy, we have this issue where how do you know who to go see? You pick the name from the yellow pages. How do you know that person is qualified? You can see a psychologist, a psychiatric nurse, a psychiatrist, clinical social worker. It is one of the most confusing aspects for anyone. Sometimes I've known patients who go see a friend's therapist, or and very often when they go to see a therapist, nobody asks, what are your credentials? What do you do? What's your orientation? You're really at the mercy of the therapist, who you put on a pedestal and hope that that person's going to help you in some way. And Lana and I are doing this to really give more information as far as we know, realistic, based on our experience with many, many patients, on what is some good quality therapy. Okay, we have a caller.
Yes. Hi, good evening.
Hi.
My name is Masha. I would like to ask you, when do you know you need therapy? Like, what's the symptoms? Because all of us, I guess, we have ups and downs, and I don't think nobody is 100% normal. But when do you know that you need help?
I'll
When do you
take
know
that,
you
and
need
you can,
therapy?
then you can
Yeah,
add to
okay.
it.
Yeah, sure.
Basically, you're asking the reason because you think you might need it or someone else might need it? Hello?
Hello, yes?
Yeah. Okay, basically if it's an ongoing condition, like you're depressed often, every day, there's no let up, you're sleeping, you're withdrawing from people, losing interest in your regular activities. But the definition is it's going on for a long time, and no matter what you do, you're still left with that low, sad feeling. Does that answer your question?
Yes. Because it's confusing. Life is hard for everybody, and it's about the choices you made, but it's hard to trust, too.
Yes,
It's hard to find the right person that you can talk to.
that's right. It takes a while to get that. Do you want to add anything to
Yeah,
that?
I was just thinking about that some people feel that they have no interest in their home or school or their work. Their life feels rather monotonous and empty. They're feeling of boredom. They have difficulty sleeping. Their eating patterns might change. They may be aware of some headaches or other insomnia. Or maybe they're doing things that they haven't done before or repeating destructive patterns like drinking, overeating, shopping, gambling. And it's been going on, as Russell said, for an inordinate period of time. Either one is feeling overly anxious or withdrawing into space, or combinations.
You know, that's a good question. Let me add to that because one of the areas we were going to talk about is what's the difference between, how do you know you're not in a crisis or in a transition, or this is a more serious difficulty? Okay, another call. Okay. Hello? 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 Can't get the call? Okay, you know, you could be going through for example, like somebody passed away close to you. Hello? Okay, hello?
Hi, yes. Am I there?
Yes. Hi.
Great, hi. I have a question for Mrs. Segway. Have you ever been in granny porn?
Have I ever been in where? Cut it off. Cut it off. Some obscene.
Another crank call for Howard Stern. Got that, Howard? You know, one of your cronies got it, I'm sure. Okay, how do you know you're not in a transition? You could be depressed because someone close to you passed away, or you came down with a life-threatening illness, but this is something transitory, you know. Or you could be very anxious because you're going to take a test, and it's going to measure your ability and your performance, and that could be a temporary thing, and it'll pass, after you've taken the test, but it could be so heightened that you think you're going crazy. And if it continues, after you've taken the test and it's, as I said, long lasting, then you would, might want to consider it a serious disorder, which could be defined as a panic disorder. And that's a serious condition.
Or it could be a combination of both. An incident that comes to my mind is I sometimes do some consulting for small organizations, and I had a phone call about Fred, and Fred worked in an organization for 12 years. And he was very well respected, very much liked, and always was a great producer of work. He was an accountant. And unfortunately, Fred started throwing around furniture and barking at secretaries, and I was called in to make an assessment. And the bottom line, just keeping it brief, is I met with Fred, and we talked about his history and a lot of other things. And it seemed that Fred was acting up because he had recently lost his dad, and he hadn't told anybody about it. I was the first person that he told. So that's a good example of what Russell was saying about a transition.
Okay, or it could be job loss now is a huge issue. Okay, we'll get back to job loss. Hello?
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 Yes? I would ask this question. I am asking, what do you do, like, when a person is very sick and, like, people are not there to take care of them?
So what's your question?
What do you do when people, like, are sick and you don't have, like, what kind of help do you need to get?
You mean mentally?
Yeah.
You would contact, probably the first thing you'd do is, it depends on whether that person can afford treatment. What kind of treatment can they afford?
Like,
That's the first question. You can go to a community mental health clinic. There's a lot of them around that take Medicaid, Medicare. And in fact, I was clinical director of an outpatient mental health center once upon a time. And you can use your benefit card to receive therapy.
Thank you. Thank you very much.
You're welcome.
Okay.
So job loss is it's happening today. People who've worked 20 or 30 years at the same job, laid off, they crash. It's not like somebody who's worked 5 years somewhere, and they're looking to change jobs, and so this was an opportunity for them to leave and sometimes do better. And that's a transition, but not everybody reacts the same way. Some people have more resources to cope with death, job loss, illness, all kinds of things. And that's part of life.
And the point that transitions could be beneficial is well taken too, because in the case of the birth of a new baby, the mother is often frightened, or the father is frightened. In the case of some milestone, with a graduation, perhaps from graduate school, the person is scared about a new career.
Amber.
And there's a natural period of what I call saying hello and goodbye at the same time. One has to mourn the old and accept the new, and that could be anxiety-provoking for a while. It doesn't have to be a serious illness.
Okay, we have a caller. Hello?
Hello?
Yes?
Yeah. Hi. I just wanted to say that I think your show is great. I love watching it. But I personally, I have issues myself. I feel that I'm very obsessive compulsive. Ever since I was a small child, I used to do a lot of counting and a lot of stacking of items. But it doesn't seem to really take away from my normal job performance and things like that. And I'm trying to wonder if I should get therapy, if there's something bigger underlying this. Is it possible?
Well, I think the next part two, we'll be talking about ways you can evaluate whether you need therapy or not. And if you could just hold.
And we'll be recommending a
We'll talk
particular
about that now.
heart-to-heart checkup, too.
Okay.
We'll be discussing.
It's like a medical checkup.
Okay. So
Everyone should have one.
Talk to them and explain my obsessive compulsive disorder, and then
Okay.
they would assess whether I should get therapy or not.
Hang in there.
Okay. All right. Thank you.
The next topic is why do people seek help? Why? Because their back's up against the wall, normally. People don't voluntarily go into therapy. Therapy is for people who want it, not people who need it, if you get my drift. So, you want to say something about that?
People sometimes, I definitely agree that it's for people that want it, not for people that need it. Most people don't really want help. They're help resisting, meaning we're creatures of the human condition, of habits that have been ingrained for years. So, for instance, somebody has bacon and eggs in the morning, and maybe they have it 4 days a week. They'll never have any sausage and eggs, or eggs over light, or a Spanish omelet. They just do the same things over and over again. Therapy is really not a commodity for extra points. It's a commodity for self-awareness, and that takes a lot of strength. A lot of people entering therapy are very afraid of what the future brings, not understanding that it's really about the past. They don't want to experience pain. They really want concrete answers.
Mm-hmm. We're going over this quickly because there's a lot of ground to cover. As I said, someone's back up against the wall. You have to almost be cornered, and you can't use any of your old defensive mechanisms anymore. You can't drink, you can't compulsively shop, you can't go running, or whatever you do to discharge the tension. You're stuck and you need some help. Another reason for not coming into therapy, is people have something to lose. That's how they're pretty desperate. Let's say they have, it has to do with a relationship that they're going to lose. And it's really traumatizing them. It's a long-term relationship. Could be a divorce. Could be dating somebody for a long time that you're so dependent on that you really didn't realize that you're that dependent on them, and all of a sudden you crash. So it's always something to lose. It could be about a job too that you've had for many years, but it's a loss. It's something you've had, you've treasured, even if it was not helping you grow, doing very much for you. It's still a loss. Something that, excuse me, that's familiar and comfortable to you for a very long period of time. Could be the death of someone. Okay, you want to say anything about that, or you want to jump to something else?
Let's move on. I think you've covered it.
Sometimes it's very normal. You know, people come into therapy because they're sad. They feel sad. They feel unhappy. They feel pain. They're not aware of why. There's no specific cause that they can put their finger on. And they don't really know what to do. There's no solution. And this could be in relation to work, and it also could be in relation to personal relationships. And what what's happening is they come into therapy feeling, should I say, smug and superior, and saying that this person's fault, that person's fault, and I have nothing to do with this. And they come in, they're very angry, but they have no responsibility for the situation they're in. Okay, we have a call. Caller?
Yes, hello?
Hello?
Hi.
Hi.
Yes, I'm wondering about, I'm comparing, let's say, the psychotherapy that you're talking about to other fields like computer science and mathematics. These are very formal fields where they lead to results. I'm wondering if maybe every 10 years or so, these psychotherapy fields keep reinventing themselves. Do you really feel like they're just wandering around and grabbing for solutions, or is there any way to formalize them more like a computer science or mathematics? What are your thoughts on that?
Keep going back into therapy, because if you have new experiences and it wasn't caught the first or second time, on the third round, oftentimes people go back several times into therapy. Even a therapist, I mean, I went back twice because I needed to iron out some old issues. I was in a new relationship, and the relationship was not going as smoothly as I thought it should be going. So it's a good idea if you're in therapy or in a non-productive therapy to seek out further counseling. You might have been with the wrong person to begin with, and we'll be talking about that on next session as well. But I don't know if that answered your question. Maybe with the news on evidence-based therapies, I'm not sure.
Therapy, thanks for reminding me. Therapy is not a science. And it's like psychology. I taught at a few colleges where research and experimentation was important. Very often you find psychologists in trying to make psychology into a science. And it's not a science like mathematics or physics. It never will be.
If I understood the answers that I got here, it kind of sounds like the therapy is considered more like a medication or like a soothing relief.
It's an art. It's an art. And it's a very good question. I'll say this now, but I'll talk about it more later. You have to be someone, it's an art, and an artist does very well as a therapist. And by that I mean you have a third ear. I have a third ear, listening with the third ear. I can listen and understand the patient, not what they're saying, but what's going on underneath all the time. And you have to have that ability to read between the lines, get to the substratum, and that, you can't teach somebody that. You can't train somebody. You either have it or you don't. You can train people in psychotherapy and technically, but the really effective therapists have that ability to listen.
They go through an institute and they're a product of their own therapy for many, many years. The difference between a psychiatrist is he goes through medical school, or she, and they prescribe medication. A psychologist, by and large, teaches. Some go in for postmaster's training, as social workers go for postmaster's training. But by and large, analysts are using their personality as an effective tool to hear what the layperson can't.
Okay, thank you.
Okay. Okay. Very important why people go into therapy that I've seen, and Lana can add to this, is that they're having major issues with work or their relationships. I'll give you an example. You have someone who is unable, it has to do with sustaining activity. You have someone who's unable to hold a job, or is always in trouble on the job with his boss, has very difficult relationships with coworkers, loses the job, goes to another job. Same pattern presents itself. Loses the job or becomes disinterested and quits, goes to another job. The same pattern is there with problems with the co-workers and the boss. And so the person doesn't understand why they can't hold a job. Same thing applies parallel to relationships. The guy has a girlfriend. Something happens between he and his girlfriend, or it could happen in gay relationships as well as heterosexual relationships, where they can't sustain a relationship. They go from one woman or one man to the next, and they wonder why they haven't found the right person. So one has to really, you can't put the onus on the person that they can't sustain the relationship. It's something about that individual that causes that problem at work and also in the relationships that they're having. And they don't know what the cause is, they don't know what the solution is. I see a lot of that.
Hello?
Hello?
Hello, Russell. Very good show so far. I have a question. You were talking about art as being like an artist thing?
Yes.
Like you're saying that you're like talking about how you have a third ear. What do you mean by that?
I mean,
it was so esoteric.
It's intuitive. You know how a woman has intuition?
Okay. Like what?
You can tell. You're able to use your instincts to get to the truth of issues.
Okay, but when you say an artist, that's a little far-reaching. That's like like a painter or something. Like I guess a painter needs intuition. Yeah.
It's really an emotional piece. It's on a gut level, primal feeling.
Okay.
In other words, as I mentioned earlier, the child is embedded with internalized parental objects. They actually drink in their family. That's not who they really are, oftentimes. It's a lot of laundry, so to speak, to sift through. In order to get to the real person, one has to have this kind of ear to be able to do the work.
I see. Okay. All right. Thanks. I was thinking you were a kook before, but now I think I'm just crazy.
There's no charge. No charge. Okay, what are we dealing with next?
I guess an example, too, of somebody coming into therapy and blaming somebody else. I recall a young man that had come into treatment, and he was complaining, by and large, that his wife was drinking too much and she was ignoring him. But to make a long story sickening, Andrew was a very disconnected man, very lonely man, and he had a tremendous amount of early abandonment issues as a child. Both parents worked long hours, and he and his younger brother were left at home. And I found that out by my relationship with Andrew over time. So it wasn't about his wife drinking. He selected a woman that would be unavailable, like his parents were.
Okay, why do people come into therapy? On the surface, one would think they're coming into therapy to, deal with, intense emotions, depression, anxiety. Some say they're coming in for self-improvement. Okay. But most, and this is for real, come in for solutions. They really feel that the therapist has solutions to their issues. And that is so far from the truth. The solutions don't lie in the therapist, they lie in the patient. And what the therapist does, he's a midwife, basically. And he delivers the patient to him or herself. In other words, the only responsibility a therapist has is to help a patient understand themselves. And through that understanding, the patient has a choice whether to continue with their self-destructive, self-defeating behavior, or to stop that. The control is in the answers are within the individual, and the control is within the individual. And it takes quite a while to get that message across to a patient. And there's always patients saying, you're not answering my questions, what should I do? That's, you get back to an infantilizing, a dependency on you as a therapist to answer all their questions and solve all their problems. What are they going to do when you're not around? You have to really help them, more specifically, help them understand their strengths and their limitations. The strengths are fine, it's great. They'll see strengths where that they didn't know about, and the limitations are the things that they're very sensitive about, that they don't even know about. And that's the meat of psychotherapy. Everyone has a dark side. No one is excluded from that.
It's a very good definition, and I want to add that it's also a paradox, because in order for the patient to get better, he has to or she has to lend him or herself to be vulnerable enough to trust the analyst, psychotherapist, and to rely emotionally until he or she can sustain being an individual. In other words, you have to be strong enough to bear the pain, and you have to know your limitations, that you can be small enough to be able to rely on your therapist. It's a very important paradox.
Yeah, very important.
That tightrope is very important. And both, it is not a one-party system. It is just not Freud in the biological model or mathematical level. It's really about walking that tightrope. And I walk the tightrope with my patients. They walk with me, and when they get off, I usually run after them, unfortunately.
Hello?
We have a caller?
Yes.
Hello?
I'm always afraid that my every time my doctor talks to me, he's always like, all right, be careful here, because anything I say that I would have to report.
Okay, well, you know what? We really need to look at...
I don't want to be reported. I mean, I don't want to be committed or locked up in the booby hatch.
Therapy is not some really complicated, quintessential mystic kind of thing.
We didn't cover crisis.
We will.
Well, no, but I have crisis.
It's basically a re-education
I want to trust
of the patient.
I want to trust the patient. I want to trust my doctor.
And if you're a good teacher, you'll be a good therapist.
No, but what about
but
the
you have to really be a good teacher, because it involves unlearning a lot of baggage, excess baggage, and then relearning what's real for you as a patient.
And it's not done only on an intellectual level, it's done on an emotional level, and that's what makes it take so long, with a variety of either overwhelming feelings or withdrawal from feelings.
Yeah, the unlearning takes a very, very long time. We have a caller?
Yes. My question is, I talked to my doctor. I'm afraid of, I don't want him committing me or anything like that. I'm very afraid. I'm very nervous. I want to trust. I want to talk. I want to be honest. But how can I build this thing? Sometimes the doctor talks to me and says, like, hey, you better watch what you say. Or maybe I'm just paranoid. I don't want to. I want to trust. How can I trust?
That's something that you have to take in your hands. You can either go on a recommendation from somebody you trust.
Yeah, but I just don't.
That's
I
a
don't
possibility.
I don't want him to think I'm crazy and try to commit me. I don't want to be committed.
Or you can take a risk. You know, therapy is risk-taking.
Yeah, hold on. I'm taking the risk of getting put in a booby hatch.
Okay, we have another caller.
No, I mean, I just don't want to get committed.
Well, you can go shopping, you know, when and if you're ready. You'll find my website on the screen here, and you can take a look, and you can go shopping. I can help you at a future time.
Hold it, shopping?
Go
like at
shopping
store,
for a
or
therapist.
Shopping for like a psychiatrist?
We'll talk about the different professions and who does really quality treatment, who's trained to do really good treatment. Part 2.
All right. Well, what about like psychiatrists and psychologists? Are they cheaper?
I said we'll do that later, okay?
Oh, all right.
Bye. Okay. You know, the really interesting thing, it's amusing as well, but it's not nice to say it's amusing. But people don't really want to change. It's like the biological model of homeostasis. The organism reverts back. If it's attacked, it reverts back to its normal self to keep a balance. It's the same thing with human beings. You live so long with certain conflicts, adjustment issues, fears, desires, that you become comfortable with them. They're safe, they're comfortable, they're familiar. And you don't want to change. Most people don't want to change. When we can, as therapists, confront our patients with a different point of view or looking at something differently, they flare. They have a certain belief system in place, and to change that is an awesome task, or to help them change it. They can reject it, what we have to say, by looking at something differently. And
but it's very normal. The patient always fights the therapist, always is resisting to get to that homeostatic state. They want to revert back to being in the crib or having a pacifier.
Or having somebody tell you what to do and how to do it. Yeah. It's, people don't really break out of the mold, don't really want change. It's a crazy kind of thing. They come into treatment saying, yeah, I want help. And then when you give them the help, no, that's not what I want. I didn't want that kind of help, you know.
They don't want awareness. They don't want self-induced freedom. They don't want to be free. They want to be children and incumbent. But if and when they get to the other side, which takes a lifetime, there are a lot of rewards.
And they don't want to be honest. Honesty is very important. You have to have, as already been discussed, there's a lot of distrust and sometimes extreme paranoia in relation to being honest with your therapist. And that's a tough one to get around. It's almost in the beginning when someone comes in, they're testing to see if this person is for real, can help them. So even when I had a thought, but I can't think of it now.
They're testing.
Yeah.
If they're real, if they can be relied upon, if you can trust.
Yeah, even when the change occurs, it's frightening. It's something new. It's like a new wardrobe. What you're doing is trying to help, to give you an analogy, put on a different suit, gown, when the patient is really comfortable with what they're wearing and how they're thinking. And so there's a battle. You're not really trying to change them, which sometimes they feel. You're really trying to get them to look at something in a different kind of way. But sometimes you have to back off. You want to say
And
something?
sometimes the person catches up and they, want to sound that it's a totally negative experience. I went through a few of them personally myself for training and personal reasons, and I think the rewards are better than the downside of it. So it is worth the pain and the trauma and the change sometimes, but not all the time. You talk about crisis.
Go ahead.
In a crisis, people think that they're ready for therapy, but it's just what we've been talking about. They may not be ready for therapy. The crisis is something that comes up really very quick and suddenly. It could be a death of a family member. It could be a teenager getting pregnant. It could be the loss of a job of 28 years. What comes to my mind is a young man I recently saw that was in a crisis. He came to me at the recommendation of the court system in New York City. I happened to be on some lists, and he found my name and said that he had a DWI and that he was interested in exploring himself. He really is not interested in exploring himself. He has a lot of issues of attachment, and although emotionally he's very attached to me, he's fighting me hook, line, and sinker. And it's a very trying experience, but he's a genuine guy, only there because it was a crisis and it looks good for his DWI case, notwithstanding the fact that he says he's ready to look at himself. He's not really looking at himself. He's enjoying himself fighting me, but that's okay.
Okay. Why people avoid help?
Too long, too expensive, too painful, too much change.
Yeah,
too
it's
bothersome,
resistance.
too routine. Who wants to come often to see a therapist?
Yeah,
By the way, once a week doesn't work.
Yeah. I should emphasize that Lana and I, what we're covering here and what we're communicating to you has to do with our own experiences. To be psychoanalyst, you have to be in treatment yourself, at least 4 to 6 years, minimum 3 times a week. So all the stuff we're talking about, the dependency, the resistance, to change.
We know it firsthand.
The need for solutions. We know it firsthand. So it makes it much easier for us to work with people because we've been there. We know it, we've seen it, and more important, we've dealt with it.
That's the artist.
That's the artist.
That's the third ear.
So it takes courage. People resist going into therapy, especially men. There are a lot more women. I would say close to 75% of the patient population are women. And the rest are males. And males have an issue with therapy. It's not manly. It's a sign of weakness. It's unmale-like. And for both sexes, it's also a stigma. It's a sign that you're crazy, but you're not. It takes a lot of courage to be to go into therapy. It takes more courage. I respect those people who go in there because it's rough going. It's very rough going. Okay, it takes strength and courage. It's not weakness. Believe me, if it's weakness, you'll never get through it. We have someone, a caller? Hello?
No.
Hello?
No caller.
Okay.
Yeah, there was an interesting brief article that I read while waiting for the cameras to come on. It was a little story of an accounting firm where they looked at a young man at the age of 36 that was crying repeatedly at his desk. And most of the employees, as well as the owners of the accounting firm, were afraid to approach him. I mean, this really speaks to the heart of being vulnerable enough to be a patient and vulnerable enough to be a therapist. Why couldn't someone with some awareness, even cognitive awareness, not emotional, go over and comfort this young man that was crying? He might have lost a pet, a family member, he might have had an illness, he might have been just given a pink slip, and everybody backs away from that kind of vulnerability. So what Russell was saying about the strength in vulnerability is really very important.
Okay.
Sure.
We have a caller? Okay, we're winding up. And what we haven't finished this evening, we will discuss tomorrow in January.
It's good.
It's good.
Okay.
Yeah, you added a great deal with your clinical stuff.